Hi, everyone. I'm Marianne Pizzatola. I am president of the New York City Organization of Public Service Retirees. And today I have with me Carole Scagnelli. Her husband is Lou, a retired NYPD officer. And this installment is our third video, I believe, in the series of stories of retirees and how this Medicare Advantage plan is going to affect them. We told you the other day that the judge found for us that this plan should not go the way it was, and all of a sudden they stopped it. But we don't believe it's going anywhere, and we believe it's important that you understand exactly how this plan or a similar plan would affect a retiree like Carole and Lou Scagnelli. So, Carole, welcome.
Hi, good to meet you.
You too. So your husband worked for NYPD. I believe you told me he started in 1965 as transit and then went into NYPD.
Yeah, Lou joined in 65 and it was transit police at that time. And then years later, transit became part of, NYPD. He was assigned most times to Brooklyn area, being Coney Island. I believe Bedford-Stuy at times, they just got moved around on the train system.
Right.
And so, of course, he worked rotating tours, and I had which was ships passing in the night at times.
Yes.
I worked in Manhattan. And so they were weeks at a time, we would just leave each other notes like, hi, how are you doing? And in 1972, we got married. And Lou had said to me before we got married, before we get really serious, when I retire, I want to move out in New York. So I was really in love and still in love. And I said, yeah, sure. That'll be fine. Well, around end of 1979, mid 79, he was awarded a hearing disability pension. And so he came home and he said, I'm getting this disability pension, and you remember we were going to move. So I gave up a very good job in Manhattan. We sold a house in Staten Island, and as God would say, in the worst real estate market, someone bought a house in 2 weeks. And all of a sudden, we were moving to North Carolina. So we moved to North Carolina. And Lou had 2 months accrued time. We went through the 2 months accrued time. We bought a house here. And he was receiving a salary, a check every month. And 2 years later, we receive a letter stating that he was being called back to duty. So
he goes back. Retired.
After he retired. And we both were like, this has to be a mistake. I mean, we're retired. We moved. We gave up everything in New York. We sold a house. I gave up family. We moved. We have a life in North Carolina. Well, we hired a lawyer because it went into a lawsuit. It was Lou and 7 or 8 other fellows, and we lost the lawsuit. So next thing we know is Lou is in New York. I'm in North Carolina. I come back on a bus because I didn't know this was going to happen. I didn't know he was being called back that Tuesday. And so after a year of being in New York, and it was really affecting him, the fact that he was in the office and he's not an office person, I said to him one day, okay, what happens if you just put your papers in? So he did. He put his papers in and he came home. And so for the next 2 years, we had no income. We had no income. We had no medical insurance. And so we lived off our nest egg. We lived off the money that we had put aside. I started a small antiques business to pick up for those bills that we couldn't pay. And then in, I guess it was about 1985, 2 years later, then after his vesting, he started receiving a pension, a reduced pension, which was less than what we had planned our lives on, because I believe the first pension was supposed to be 3/4, no tax, and this was reduced with taxes taken out. So I've already gone through the New York City and, the government of New York City, and this is as upsetting as that was. This is more upsetting because Louis is now 81, going on 82. I'm going to be 80. We don't have the good health we had then. We don't have the stamina we had then. And the anxiety we had to deal with then, we were so many years younger that you just say, okay, you hitch up your pants and you keep on going. Well, the anxiety of this is all falling on me because Lou had a massive heart attack. He's had some brain injury because of being deprived of oxygen for as long as he had been. And any anxiety that he has to face just sets him back.
Mhm.
Sets him back to the point where I said to him one day, okay, we have to leave. You need to put on your shoes and your socks. And he did. He put on his shoes and then he tried to put on his socks. And when I said to him, what are you doing? He said, well, you told me, put on your shoes and your socks. He said, I couldn't figure out why you wanted me to do that. I thought, oh God, is she losing it? So it's those situations that I can see. So all of this
Just make it more stressful for him.
just makes it much more stressful, much more stressful.
And so
And
dealing with a smaller pension because of how he had to retire, not
yeah,
what he expected.
no, not at all, not at all. So that was a tremendous change in our lives. And about 5 years after all of that happened, and the reduced pension was coming in, we were driving one day, and he said to me, you know what? If I knew this was going to happen, he said, I wouldn't have put you through that. He said, because I know this is my dream and not yours. He said, and it's not the life that I promised you. And we've never recovered all those funds or the years in between that were planned, and those plans that we had made, because everything changed. Everything changed. I could have stayed in New York and I could have kept my job, and we would have been way ahead, because my job at that time, my salary was almost double what Louis' salary was as a policeman. And he was living in the stress of going out every day on the job. And mine was just dealing with difficult people.
Right.
But I was being paid for it, dealing with difficult people.
Right.
Yeah.
Right.
So that impact was a lifetime impact, but this now could be a life-ending impact for us, because our doctors are not taking this plan. The two major hospitals here have told me they're not, they don't know anything about the plan, and in not knowing anything about it, they're not taking it. And so,
Well, let me ask you
this is
about that.
devastating. Yeah.
You started asking your physician's offices about it, and the doctor said, hey, I just your doctor, you got to talk to billing. So you'd call up the billing offices for the physicians, and what were they telling you?
I looked on that little web link they had, and
Empire Blue Fine Care link.
yeah, and all my doctors were listed there. So I had an appointment with my GP, and I went into my GP, and he did the exam and everything. And I said, I think our insurance is going to change. Do you take this? And he said, I never heard of it. You need to call billing. So I called billing, and the girl said, no, we don't know about it, but I'll tell you what you need to do. I'll give you a link, and you need to go there and look up each of your doctor's NPI numbers. Well, between us, there are 18 doctors.
Wow.
Because I've had cancer twice. I've had 3 back surgeries. So with the back surgeries, it's not only the surgeon, the orthopedist, doctor, there's the PT, the occupational therapy, and all these people, Louis' cardiologist, his GP, some cognitive doctors that we need to see. So I spend a day and a half looking up NPI numbers. And then Novant Health calls me, billing department, and said, okay, now that you have those, you have to call whatever that Advantage Plan is, which is Alliance. So I call Alliance, and I said to the girl, okay, I have all my doctor's NPI numbers. I'll give them to you. You need to tell me if they're taking it. And she said, oh, we don't do that. And I said, no, you have to do it because you're the one. I've done a day and a half research getting all these numbers because, these are multiple doctors. They're not all in one place. And she said, no, we don't do that. And she hung up. So I called billing back for Baptist Hospital, and I explained, and they said, well, we don't know anything about it, so we have nowhere to go. This is something you need to do. Well, they're doing it to us, so why am I doing the work?
That's one of the biggest things we didn't understand is, and I think the unions have this problem as well, because several union people have said to us over the last especially over the last week, well, if all the doctors take Medicare, then they'll take this plan. And I said,
No.
well, nope, that's not true.
No.
It still is any doctor that accepts Medicare can accept this plan. Doesn't mean they will.
Mm-mm.
And you can put your doctor's names in the Find Care tool, which was generated by Empire and Emblem Health, which makes the alliance. And yet you can call the doctors on that list just like you did and find that either your doctors don't know anything about it, they do, and they don't want to take this plan, or they're adamant about not taking any Medicare Advantage plan, whether this is a special plan, plus plan, they want nothing to do with this plan. And they'll have received outreach from the alliance, newsletters, emails, webinars, blah, blah, blah. They want nothing to do with this plan because they know how traditional Medicare works with your supplemental, and you know that you get your care timely. In this situation, that isn't the case. And if you're out of state, so I'll give you a phrase, it's called LPPO, it's called a local preferred provider organization. And what they did is they basically took, you have Emblem Health, which is basically in the New York metro area. And then they took Blue Cross, the Blues they call them, and they have Blues in all different parts of the country. And what they did was they stitched them all together to make a national network. And that's what they call their national network. It's basically a house of cards, but you have to then go to all of these blue plans, and then the blue plans will say, well, the Empire link says your doctor's in the plan. Well, your doctor is in one of those blue plans, whatever region you're in, North Carolina, Texas, Washington, Oklahoma, but they may not want to take this plan. And they may not want to take any Advantage plan, even if it's a special plan. And then that's where you fall into some trouble. So then to find this out, where you were doing your due diligence to find out whether or not your doctors were taking it, to learn that they weren't, all the unions keep hearing, well, if they take Medicare, they'll take this plan. That's not true. It's not true.
No.
You learned that the hard way, and you weren't even able to get the Alliance to help you on that. But you're not alone, Carole, because there's over 500 people, 500 affidavits that we've collected, statements from retirees that they have the same problem you did in states all around the union. You're not alone in this. And it's not just that the doctors didn't know about it. The doctors were adamant. We even have retirees who were doctors for the city of New York, providers for the city of New York, and they found themselves in the Find Care tool and were like, I'm not taking this plan.
No.
So now
I looked up, when I saw all my doctors were on there, what really made me start to question even more is I looked up a doctor who I had used years ago, and I can't recall his name. I've been trying to think for 2 days now, but I looked up his name. He's been deceased, and he was still on that list.
You're not the only one that told us that either.
And I was hysterical. I went out and I said to my husband, the miracle of all miracles. I said, I can't get this prescription filled, but I know he gave it to me originally. Maybe he can send me a prescription.
Yes.
So, when I saw that, I was like, something's not right. But I had the ability to look this up. I have a friend who had got the book in the mail and just thought it was a Medicare book, a typical book. He threw it away. He never opened it. And until I called him, he didn't really understand. And then it broke my heart, because when he did understand, he had so much anxiety that he basically closed down. He closed down. I saw a man who was so strong on the phone with me in tears. His wife is in early onset Alzheimer's, and he was in tears. Well, I can't do this. I can't do this.
No. And this is frustrating on a lot of parts, but we were talking earlier about those who are in needing extra care because, as we get older, we have a lot of health problems or cognitive problems. We might be in a living facility or needed assisted living. And these are things that even in situations, we have another person whose daughter is on Medicare and Medicaid and is in institutional facility. Because the Medicare Advantage Plan would not permit them to have a Medicaid plan or a secondary plan, they would be precluded from having that kind of a coverage. So they'll have to come back home. They would be kicked out of that facility. We received several emails on that. That'll probably be our next video. But you also had said something to me that you have several friends that are in your area in the Carolinas, in North Carolina, that are not on the computer or have struggles with finding this information out the way that they did, and tell me briefly about that before we close, or if there's anything else you want to add.
Well, I have one friend that lives down at Lake Norman, and so the hospitals in that area would be Charlotte hospitals. And so she called, I believe it's Presbyterian, perhaps in Charlotte. And she called there and they said, we never heard of it. We have no idea. So then she started calling her doctors, because they moved to North Carolina for, you know, to be out of the hustle and bustle and everything in New York and have an easier life to live. And now she finds out none of her doctors are taking it. But she didn't have the capability of doing that all herself because she has health problems. And so a neighbor helped her. Um, she went to a senior citizen place, which isn't easy today because so many places are closed still because of COVID. Places that normally would help seniors, that they don't have the ability to help because of COVID. We're facing that too. That help that would be there is not there. And she said, I can't afford to move back to New York where I might get coverage. There's no coverage here. So I said to her, the only answer to this is the answer that we made is just opt out and somehow figure out if we have to pay for it, we're going to have to pay for it, because at least then you have your doctors. When you need a test, you're going to have the test. The time period of having the test already with the condition the hospitals are in, you have to wait sometimes a week to 2 weeks. If you have to wait for them to pre-approve it first, and then additionally wait the time, if I'm a 2-time cancer survivor, if you have to wait to find out first if you have cancer, then how serious the cancer is, and you're waiting 5.5 weeks, the anxiety that you're living through that 5.5 weeks is
Right.
unbelievable. I mean,
You're referring to the prior authorizations that come
yeah,
with the plan, whether it could take up to 2 weeks to get your prior authorization, you're saying, plus the week and a half or whatever it is to actually get on the schedule at the facility.
at the facility, plus you've already waited maybe 2 weeks to get a doctor's appointment. And if it's now with, so many offices not really taking on full patient schedules, you can wait unless you walk into your doctor's office and you're bleeding profusely. You have to sit in your car and wait for them to call you into the office. So you could wait a week for a doctor's appointment, 2 or 3 weeks for pre-authorization, 2 weeks to finally be able to have the test, and then the other 4 days waiting for the results, and then another 5 days to get in to see the doctor, to find then a specialist to perform whatever surgery or,
And it's crazy because when
it's
another
crazy.
unions have said to me, well, their prior authorizations is no big deal. You could get around that. No, you can't get around that. And this is one of the realizations that they don't understand because they're young, not familiar with Medicare, not familiar that Medicare traditional does not come with a prior authorization like these Medicare Advantage plans, whose primary goal is to save money, AKA delay care, not authorized care, because it's a for-profit making company. And it's truly telling because the unions had even turned around and said, well, the savings from this will, help fund our raises and support our stabilization fund, which will give us the welfare fund money. But you're right, but it shouldn't be by providing a plan that potentially permits a lower level of care than we are currently used to. And the last thing on that topic would be, we talked about out of network. And if you're out of network and you're in the North Carolina area, and we have retirees in Tennessee that are friends of ours that one is GHI and one is not GHI. Oh, I'm sorry, they're on GHI, one is Medicare and one is not Medicare. The non-Medicare spouse who is on GHI full time, there are no doctors in Tennessee that take GHI. They have to either go to Florida or go to New York to see a physician. So this is a real thing when we start talking about networks or a national program. And that becomes a problem finding care for a split family, we call that, especially since the city doesn't allow for split families to be on different plans. You have to be on the same plan.
One plan.
Right. So now you're in an area that if your doctors will not accept Medicare Advantage, will not accept billing for Medicare Advantage, you are truly an out-of-network person. You still want to see that doctor. If you can't find a doctor that takes that, you've now lost your continuity of care. You start over with the new physician that's in that plan. If you choose to stay with your original doctor, you're out of network. What does that mean? That means that you have to, if the doctor won't take the plan, won't accept billing from the plan, payment from the plan, you have to pay that doctor out of pocket up front for his services and submit that bill for reimbursement. Now they'll say, oh, but we have like a $1,400 and whatever it is dollar maximum out of pocket. But by you taking that bill and sending it into the alliance or whoever, whatever vendor they come back with, that you're asking them for reimbursement, they are then taking that as their ability to determine medical necessity. If they come back and say, hey, Carole, I don't think that test was medically necessary. Sorry, we're not paying for it. Guess what? That's out of your pocket, truly all on your own 100%. And then you'll say, but I have that maximum out of pocket thing. And they're going to go, no, that doesn't count towards that either. Now you're on a fixed income. You're on a reduced pension. You are seeing a physician out of pocket. You now have newly installed copays, which we never had on top of it. So you had to pay the $15 on top of that. The doctor asks you for payment in full because he won't accept this plan, won't accept payment for that plan. You had to pay a couple $100 writing the check to the guy or give him your credit card, submit it to the alliance, and then to learn they're not approving it if they don't approve it, and you're truly out of pocket for the whole dollar amount. And that could happen throughout all your 18 doctors because
18 doctors, yeah. Well, yeah. The other thing is, especially with the back surgeries that I've had, there were two doctors in the same office, and they had a consultation because one was saying, I think if she does 6 weeks of PT, it'll alleviate some of this pain. And the other doctor said, no, you know what, we're going to do an MRI. So we did an MRI, and when they both looked at the MRI, it was, okay, we're going to set you up for surgery come Wednesday. So I said to the first doctor, well, you know, what would have happened? Would there have been a change if I did the PT for the 6 weeks that we wanted to put this off? And he said, well, you know, in most cases, well, he wasn't in the pain I was in. Lou had to help me out of bed to go 8 steps just to get to the commode. And he was telling me I was going to go to PT for 6 weeks. So the alliance would rather send me to PT than have me do surgery.
Yeah.
Yet they're not living in my pain.
And we have another story on that one that we'll probably be coming up with soon, where actually it was a GHI denied the person. And that person ended up having multiple amputations and ended up dying.
Oh my God.
They had delayed her MRI for more physical therapy that they'd already done, and then she ended up losing her life. But what I'd like to do now is ask you if you have anything else you want to add, and then we can wrap up your video. Is there anything you'd like to let these people know?
Well, yeah, I have concern for all of us. I also have concern for the fact that in listening to all of this and then listening to what some of the people who are still working, you know, and Marianne had done that informative little video on how this is going to affect you, those still, you know, working. I think what the union is doing is trying to put the retirees against those working and those working against the retirees. I don't think that those that are still drawing a salary really understand what's happening. You know, the unions are saying to them, basically, if you don't agree with us and what we're doing, the monies that you would get in raises, you're not going to get, and it's the retirees' fault. And that's not true.
No, it's not.
I mean, that's not true. They're trying to face us off against each other, and that's so unfair. That's so unfair, because my husband got dressed every day, put on a gun, which I never thought I would marry a policeman, put on a gun and went out. And I would say, be good, and I'll see you tonight. Why put that police officer against another police officer? Why put a first responder against another first responder? I didn't do it. You didn't do it. It was the union that did it. And they don't understand that it's the union that did that. We're not denying you. And in my heart, I know you're not denying me because you don't know it.
They don't.
But we're the ones suffering for it. You know, we're aware of what's happening. It's, you know, people younger than me who have medical problems, who can't talk and speak for themselves, and they have no idea what's going on. Because even younger, if they had the capabilities that we have of finding out or having somebody help us, they're sitting in assisted living, they don't even know where they are. So what happens when this, if this change comes about, where do they go? If they don't have someone like that, the woman who has her parents, but her parents need help.
Yes.
So, I mean, you know, to me, this is devastating on so many levels. Yes, it affects me. And this falls to me because my husband can't deal with this. And if he has to deal with this, it'll put him back to when he had to go into brain injury. And it'll put him back to that day when they put that wooden puzzle in front of him that had the triangle, the circle, and the square, and asked him to put the pieces in, and he couldn't do it. He couldn't do it. He looked at me as if to say, you do it for me. And
So
I've done it. I've done it all these years.
Yeah.
So what happens to him if something happens to me? And there are so many people like that. There's one person who's really ill and it falls on the other person. And in most cases, I need help.
Right. Yeah. You make some very good points, Carole. So I want to end this here. There's a lot to learn from you, and maybe we'll bring you back another time and we can talk again for another half an hour. No. It's important that people hear your story because our situation doesn't resonate with them because they're so much younger. People on the job today are 20s and 30s and early 40s, and they don't hear the stories you have. They are not familiar with the issues we have, the problems we have. And I've been saying this from the get-go. A union represents a person who has wages, hours, and work conditions. Their lives are so very different from someone's life like yours. They don't have the problems or faced with the problems that you have. And they have to know that they will be walking down the same road you're on. And they need to know how that will affect you. Because the union presidents we spoke to over the weekend have no idea about this. They're hearing the city, the alliance, and the MLC start saying how wonderful things are. They're not listening to your perspective. So it's important that they hear your perspective. So I want to thank you for sharing your story with us. And we'll be talking again, I'm sure.
Well, I from the bottom of my heart, I appreciate everything that you have done, that the group has done, because without you, I mean, all of us would have been in the dark. We would have found out when the time came that we needed the help and it just wasn't there.
we have a very good team on this, and I'm very proud to be part of that. And then thank you for appreciating that, because this brings us many a sleepless nights, I'll tell you.
Yes.
Well, I'm giving you a hug. It was great chatting with
Oh,
you, Carole.
you too. Thank
All
you.
right.
Bye.